I'm Bowling Green Mayor Mike Osbacher. This is a difficult time for our community, the country, and the entire world. But I want you to know that the city, Bowling Green State University, the Wood County Health Department, and Wood County Hospital are working together to see our community through this. Here's an overview of some of the things we're doing and how you can help.
Thank you, Mike. As a public university for the public good, BGSU is committed to supporting our community. This is a very challenging time, and we continue to work to slow the spread of the coronavirus to safeguard our students, our faculty, staff, and of course our neighbors. We've moved to online learning for the rest of the semester. Staff who don't have to physically be here on campus are working remotely, and nearly all of the 6,000 students living in our residence halls have gone home. We're doing what we can to help address the shortage of personal protective equipment, or PPE, for the healthcare providers who are on the front lines. We're pleased to have been able to donate thousands of goggles, gloves, and masks, and if needed, we're prepared to offer our facilities to house medical personnel, first responders, or even patients. I know the absence of our students has been very difficult for local businesses, and I look forward to the day that we all will be able to safely return to class and to work. And that day will come sooner if each of us follows the directions of Governor DeWine and our state and local health officials.
Thank you, Rodney. We know there are COVID-19 cases in our communities and many more that haven't been diagnosed. I wish I could tell you how long all of this will go and when we can get back to anything that feels like normal, but I can't. What I do know with absolute certainty is that our fate is in our hands. It's critical that we all follow the public health guidance that you've heard so much about. You are essential to helping us fight this virus. Here's what you can do. Remember to practice social distancing, staying at least 6 feet away from others. Stay at home except for work at an essential business or to run critical errands like grocery shopping or to seek health care. It's especially critical for you to stay home if you're sick with fever, cough, or shortness of breath. Anyone living with someone who is sick should stay home too. And if you've been sick, you need to stay home for at least 7 days until you've not had a fever for at least 3 days and when your other symptoms have improved. For more information, visit us at www.woodcountyhealth.org. If we make these actions part of our regular routine, we can be part of the solution. We have a responsibility to try to slow down this virus and lessen the impact on our healthcare system.
Thanks, Ben. Well, welcome from the Wood County Hospital Patient Care team. We're really glad to be here today. We wanted to let you know we've been preparing, planning to take care of people during this pandemic. A couple of tips for you. If you're not feeling well, it all starts with your physician. So call your physician. Most of our physicians are doing telehealth visits out of their office. You don't need to have a fancy computer. If you just have a phone, we can accommodate you, but they will give you guidance. In many cases, if you're starting to feel bad, they'll tell you what to do to stay at home and recover. Some people do need to come to the hospital, and we're here and ready for you then. The other thing I want to just mention, and you might have heard about this already, social distancing. It is really very, very significant. Hand hygiene, washing your hands regularly. These are our two most powerful tools that everybody in the community can use. And when you hear the term bending the curve, we are bending the curve in Ohio, and the reason we're being successful is because we've been practicing this. So please do join us in taking care of the whole community by practicing social distancing and good hand hygiene. But remember, if you're not feeling well, your doctor gives you directions, you need to come to our hospital. I just want to let you know we are ready for you, and you can always depend on us.
Thank you, Stan. Walking downtown right now and seeing empty streets and closed stores is a striking experience. While it may look a little different, please know that the city is still functioning. We're continuing to provide police and fire protection, utility services, and refuse and recycling collection. I know this is a very hard time for businesses, employees, and our residents. We're here for you and have instituted policies to help. From the start of Ohio's stay-at-home order, we've stopped all utility shutoffs. Whether you're a business owner or a resident that may be struggling, we're committed to continuing to provide your electric, water, and sewer services. If you're having a hard time paying for your bills, please call the Utility Business Office at 419-354-6252 and talk with the staff so that we can help. And go to coronavirus.ohio.gov to connect with other resources like small business loans, utility assistance programs, and expanded employee benefits. I also ask that you stay engaged with us. Visit our website and follow us on social media for updates and attend public meetings virtually at bgohio.org/meetings. There are a lot of things that make our community special, but one of the things that really sets us apart is how we come together in a crisis. I want to thank the university, the hospital, the health department, and most importantly, all of you for doing your part. Together, we will get through this and become a stronger community.